everyone for logging into our Wellness Wednesday webinar. This is a platform where we focus on health and wellness with specialists and experts answering your questions about physical and mental well-being. My name is Zarmina and I'm delighted to be on the journey with you today. Today we're in conversation with Dr. Rekha Murthy. She is an infectious disease physician, professor of medicine and healthcare epidemiologist. She serves as the Vice President for Medical Affairs and Associate Chief Medical Officer at Cedars-Sinai Medical Center in California. Thank you so much for being here with us today, Dr. Rekha, and good morning. How are you doing?
Good morning. It's a pleasure to join you, and thank you for asking me.
Well, it's great to have you, Dr. Rekha, and in particular, your profile and experience is astounding, and more so, the field you are in is at the crux of the matter today. I'd love to ask you what new developments and new information have you seen with regards to COVID-19 symptoms, treatment, testing, and are there any common myths that you find yourself having to continuously dispel?
Yes, I think that's a fantastic question. And I will start off by saying that there are some things we've known from the early time of the pandemic that have not changed. And I think those are equally important, perhaps to emphasize, and then I'll dive into some of the new developments. So what hasn't changed and what we've known from the beginning is this is a novel virus that's really we've never experienced before. And we do know that it's highly infectious, highly communicable person to person, and that it's transmitted through respiratory droplets, coughing from one another, coughing within 6 feet, and or other activities that dispel the virus in droplets that can land on surfaces or actually infect somebody who's close by. The other piece is that we know that with a lot of data that infection prevention measures such as hand washing and social distancing and wearing a mask do work. So I think those are important issues to remember, that despite almost a year or more than a year of having experienced this pandemic around the world, those are some facts that we know persist and continue to be true today. Masking works, social distancing, as well as hand hygiene and environmental hygiene. Having said that, there are some other information that I think that we've learned a tremendous about this virus. First of all, we've learned the importance of the fact that people don't have to be sick to transmit the virus, that more than 50% or half of the people who have the infection or have the virus may not actually manifest symptoms, and yet because it's a respiratory pathogen, they can still transmit and infect those who are close to them, including family members, co-workers, and others. And so that's one piece. The other is that we are realizing that, like other viruses, these pathogens and microbes in nature, they don't stay the same necessarily. And what we've known is primarily one major strain initially, we're learning that there are potentially other new strains that are developing. So we know this is not going to be static, and we don't know what to expect because these viruses are known for their unpredictability. So there may be other changes we should anticipate. Thirdly, well, I'll go back to that to say, so far, despite the new UK strain, however, it does appear the vaccine is effective as well. And however, I would say that just like with what we experienced last year, it's inevitable that this new strain will also find its way in spreading around the globe, just as the initial strain has. And then the last two or three comments I'll make in terms of new developments include the fact that we have had a remarkable explosion of science and biotech and really the race to try to get not only testing strategies, but also treatment strategies and also vaccines. So I think we'll live through 2020 as being a remarkable demonstration of what can be achieved when the scientific community comes together. So new treatments are now available to help in actually reducing the likelihood of bad outcomes and treating patients in the hospital and also those who may not be in the hospital yet. Vaccines, I think, are a tremendous achievement. That fact that we have now two already approved and many more in the pipeline, and that is the most important, second to controlling the infection transmission. That is a critical aspect of controlling this pandemic. And then I would just say the last piece is testing strategies are going to be an important component as we go forward of continuing to control pandemics. So these three things, testing, treatment, and vaccines will be an important aspect of going forward as we control the pandemic. And then the last thing I'll say is that now more than ever, I think this pandemic has illustrated the importance of having public health infrastructure to really be able to implement at a broad population level measures to help people understand why it's important to do these strict measures and be able to turn the corner. And once we get control of the pandemic, then these public health measures are going to continue to be important, because we have now learned that contact tracing is an important way as well of controlling the spread once you identify the disease. So those are some things that I hope that I've covered some. I'm happy to answer any questions about that.
Thank you so much. I'd love to unpack that a little bit. And you touched upon such a key point that it's not static. The virus is not static. And I feel that it's kind of been a shock maybe to the lay audience and the larger public that there's a new variant and we're hearing that it's more dangerous, and there are different viral loads. Could you unpack that a little bit further? Is the new variant really more dangerous?
Some of this is yet to be really well understood. I think clearly one of the key concerns is with any new strain, when it comes to viral illnesses, the key issues we worry about are communicability, like how infectious is it, and severity of illness that it causes. How much more ill can it make somebody than the current COVID-19 strain that we've now circulated the world? And then thirdly, are we going to be able to rely on the current mechanisms of treatment and vaccines to be able to be effective against new strain? And I would just say that as more information is evolving, at present it appears that though there might be some signs that perhaps it might be more infectious, it's not clear, but it is definitely seems to be responsive, or at least included in it does seem the vaccine is effective. The new mRNA vaccines appear to be effective against this strain. So I think the most important thing for the public is to know this is important as there is a evolution of science and understanding, and this is part of the role of scientists and public health, is to continue to monitor any evolution of issues and share the information as quickly as possible. It took us some time to understand early on last year that the COVID-19 virus can actually cause severe disease, not only in those who are elderly, but also in younger populations who don't necessarily have major illness. So, and we know there's a spectrum of illness from asymptomatic illness to those individuals. So those are individuals who don't have symptoms. And if you follow their course, they don't develop symptoms. And then those individuals who are pre-symptomatic, and these are individuals who actually develop symptoms, but they're contagious even before they develop symptoms. And so those kinds of understanding. And then there's a spectrum of people who develop severe illness and need hospitalization, and of course, bad outcomes. So I think those kinds of understandings need to evolve for these strains. It's not necessarily a surprise, but I think it is something that there's close scrutiny and monitoring, and is included in much of the monitoring around the world now.
That's great. And you touched upon the vaccine, and actually we've already started getting some live Q&A about the vaccine, which we will get to in the second half. But I want to ask you, Dr. Rekha, is there too much optimism surrounding the vaccine, and is it truly a solution to this pandemic? Because we hear both sides of the coin. What's your take on that?
I think that's a really important question in terms of trying to understand the relative impact of what can we do from a scientific and an individual perspective to control the pandemic. We have a long history of vaccine preventable diseases that we know with childhood immunizations that have now become a standard, that we've eradicated for the most part many infectious diseases, and other than some clusters that emerge. I think polio is a good example, measles for the most part, although we still have some outbreaks now and then, smallpox. So there is a long history of the success of vaccines in being able to protect the population from the devastation of these infectious diseases, and particularly in viral illnesses. Every year, influenza vaccine has a huge impact on preventing serious hospitalization and deaths in elderly people, those who are vulnerable. And so there's no doubt that there's a vaccines work in protecting individuals. And so to fast forward to this particular experience, this pandemic, most in our lifetimes have not experienced anything to this degree. And we know that these viruses and infectious diseases really know no borders. And with our current globalization and global travel and commerce, we can't really contain infectious diseases or these bugs in borders. So these don't respect borders. And so we have the scenario where we have an extremely infectious virus, and that really doesn't discriminate. And we know we see people who can get sick, and though many people may not get sick, we have the prospect of transmitting in broad sectors of the population. We've seen it continue now. I certainly have experiences in many parts of the world, and now here in Southern California, where we're experiencing a particular increase in the activity. So if we step back and think about that, and the history of vaccines, and we know we have at least these new vaccines that are 95% effective, and they've been demonstrated in many trials to actually reduce the likelihood of developing COVID once individuals have been vaccinated, even after the first dose, but definitely much more so after the second dose. There's good data that it's effective. Now, so in terms of rolling out to healthcare workers, that's actually obviously the first group that it's being rolled out in this country, and soon to follow the rest of the population. So if we think about what do we need to control this pandemic, it comes down to, I think, 2 or 3 things. First of all, we've got to stop its spread. And we know that there's some challenges in being able to enforce the types of behavioral changes that are needed to continually wear masks, to try to social distance. Those are difficult things to manage, and we have to get our economies back. And then we're seeing strain on the health systems in terms of people who need hospital care and resources. So the role of vaccines becomes very important in starting to turn the corner. And there is this concept of if you look at a population, that if you get enough people vaccinated, that starts to reduce the burden of virus in that community and reduces the number of people who might get sick. And then we can start to turn the corner and implement more specific contact tracing, get the public health measures in place that will help to target to those smaller clusters, as opposed to now, which is really a very vast and difficult to manage without doing these wholesale across the community restrictions that we're seeing. So there is this concept of herd immunity that is what I'm referring to, that if any pocket of population, that if you vaccinate enough people, and that can vary depending on the disease, but that starts to reduce the burden. And that's been tried and tested in other diseases such as influenza and other viral or respiratory illnesses, measles. And so, yes, so the answer to your question is yes, it is important. Vaccination is a very key component of controlling disease, this pandemic, so that we can move to the next phase of actually starting to manage the smaller clusters and sort of get back to normal.
That's great. Thank you. I know we'll be coming back to a little bit more about the vaccine in our live Q&A So I just want to ask you, Dr. Rekha, we've just crossed a period of seasonal holidays, of New Year's, of the time of year which is celebrated in a lot of parts of the world. And to add to that, I would say, political climate in a lot of different places as well. Do large gatherings such as protests, weddings, other large events, is that contributing to a spike that we're seeing in a lot of parts of the world? People were in two minds of, should I travel to a holiday destination or should I remain in lockdown in the new year? What's the reality there?
Unfortunately, we have seen evidence over and over again that is the case. This is a highly infectious virus, and we do know that that there have been links to increases in cases after large gatherings. There have been numerous reports, unfortunately, of weddings. This is last year, where numbers of individuals, conferences, large gatherings, or even small gatherings. And some of them, of course, we've seen with these, what they're called super spreader events, which might serve to really have those individuals who gathered then go back to their communities and then serve as a source for spread. So that kind of ripple effect has significantly impacted the spread of this virus. And I think there's a pretty clear evidence that that's the case. And so, it is one of those difficult times where it calls on all of us individually, as well as collectively, to find ways to control this and protect our loved ones and families and friends and coworkers to contain this disease. And again, I think vaccination will potentially help to ease some of these transitions, so that we can look to hopefully control this pandemic.
Absolutely, that's a great reminder. I feel it's always good to share that message to everybody watching. And Dr. Rekha, we hear a little bit, actually not enough, I feel, about what does COVID-19 colors mean? What is meant by that? I've done a little bit of research on it, but it's not something I'm hearing. What does that mean, and how long does the persisting fatigue that's associated with it last?
So we continue to learn. I'm sorry if I didn't misheard. I don't think I heard fully the question, but I think what I understood is you're asking about COVID-19 related fatigue. Is that
Yes,
what you asked? Okay.
and I believe that's post when you have COVID, when you're COVID positive, the long haul or COVID long, I think they're calling it now. What exactly is that? Does that mean?
So we are certainly learning a lot about this illness, and we are understanding that, one, it impacts people different ways. It does seem to have manifestations that we don't generally associate with a viral illness, but it's not clear yet whether this is directly related to COVID or whether it's host factors like individual patient factors. But there are prolonged number of long consequences, phenomenon that are being understood or described. And scientists will be looking to understand this over time. Certainly fatigue is one. There are some individuals who have heart complications, and we're just beginning to understand that. We know this virus appears to cause in people with serious illness clotting. And so clotting disorders that seem to contribute to blood clots in the lung. So there are manifestations that again, that are being described, whether this is directly related to the virus and its properties, or that because we've not seen this broad scale of infections from this communicable disease, some of this is sort of trying to, as you put, unpack whether this is a virus related or whether this host factors. So, but no doubt it's a serious illness. And I think that's one of the common myths, as you pointed out earlier, in terms of understanding myths. I think a lot of people misunderstand that this is just a typical virus, that we shouldn't worry about it if we get it. But we know that it's unpredictable. We know that it can cause serious illness in those who don't have underlying illnesses, including young people. And if we could predict and say these are the individuals who are going to get sick, that might be helpful. But we know that it's a broad spectrum. I think those are really important factors to help dispel the myth that we should not worry about getting COVID. I think we're fortunate for those individuals who have no symptoms or who just happen to test positive or don't get ill. But for every one of those, there's another individual who has a serious illness, whether it's mild symptoms to moderate to needing to be in the hospital in a smaller proportion, who become ill and require ICU care. So, we understand that about 80% of people may have mild to moderate illness, and about 14% may have severe disease, and about 5% may have critical illness requiring ICU care. And that it doesn't necessarily discriminate. We've seen all ages and all sectors. So I think it's really important to dispel that myth.
Absolutely. And following on from myths, Dr. Rekha, data indicates that the mortality rate reveals deep inequities by race. Can you share a little bit more with us? Who are the most vulnerable?
Well, I think there are a few things we're learning, that there are disparities based on epidemiology. So if we think about where individuals, whether it's based on racial or ethnic disparities, because it appears, at least in the US, there are Hispanics are about 4 times more likely to be hospitalized than non-Hispanic Caucasians, whereas those who are African American, American Indian, or Native populations like Alaska Native populations are about 5 times more likely. But the important thing is to realize that some of these reflect socioeconomic factors in terms of where the communities are. It might in fact reflect based on underlying illnesses that may be more predominant, that are linked to these socioeconomic, or what we call social determinants of health, that there are predisposing disparities in health of the underlying risk factors that kind of put these individuals at higher risk for complications from COVID, which again doesn't discriminate. And so those are some factors that I think are beginning to be understood, and clearly has become an important part of responding, not only in terms of education and contact tracing, but also making sure the vaccine and testing are really ensured to include all populations.
Absolutely. Thank you. Thank you so much for breaking that down a little bit for us. I want to go back to what you had mentioned about pre-symptomatic and asymptomatic. In either of those cases, does that mean that one cannot transmit the disease at that time, or the virus at that time?
So that's actually a really good question, and another myth. And so it turns out that the individuals who, as I mentioned, who are asymptomatic, and some of this data was derived from the cruise ships where the early outbreaks were described. Individuals who were on the ship were evaluated to see if they had a positive test, because everybody was tested. And there were some individuals that had a positive test who never got symptoms. And then there are those individuals who had a positive test who developed symptoms. So the people who had a positive test who never got symptoms were called asymptomatic, because they remained free of any symptoms. Those who were pre-symptomatic were those individuals who had a positive test and then subsequently developed symptoms. And we know from this virus that it is contagious. Even in somebody who has symptoms, it is highly infectious even several days before somebody gets symptoms. So that's the pre-symptomatic transmission. But we've also learned from those studies and epidemiologic studies that even if you're asymptomatic, there is the transmission risk is equally high and can occur, because again, this is a respiratory virus. And so it's, even though you may not develop symptoms, that when you cough or sneeze near somebody, this virus may actually spread and transmit to others. So yes, the answer is yes. And that's often a common misconception. And that is one of the drivers for the universal masking mandates, because we did not understand that early on until some of these outbreaks in nursing homes in cruise ships, and it began to be understood that that role of asymptomatic transmission became much more significant than we understood.
Thank you. Thank you for clearing that up. That's very helpful. So, with the vaccine available, I've taken my first dose. I'm somebody who takes the flu shot yearly. Can we expect this to become a seasonal virus? Will we need to be seasonally vaccinated? Should we wish to do so? What can we expect?
So it's a very important question, and like much of this viral disease and this pandemic, um, it's it's not clear yet that we have an answer to that. And so we do know that whether it's because of the pandemic or whether it's because of the virus, it hasn't exhibited any seasonal factors yet. So it's been pretty rampant all year long, unlike influenza, which tends to wax and wane based on the seasons and temperature, weather and temperature and humidity. It's possible that once we control the pandemic and get vaccinations back in, it might be possible that this might linger on, and perhaps other factors such as the environmental factors, like in winters when there's more congregation, it might appear to be seasonal. But there are several factors I think that we just don't know yet, that we need to allow time to be able to understand this. First of all, I think there's virus-related factors. As I mentioned, these are dynamic. Viruses and other microbes in nature generally don't necessarily always stay the same. There may be mutations that emerge that might render it less infectious, more infectious, might change its nature of how it survives. We know 20 years ago when the SARS epidemic occurred, that it kind of disappeared after, and it was a coronavirus as well. This virus doesn't seem to be doing that. So that's one factor we don't know. I think vaccine use will have a big role to play in understanding, then teasing out whether you get enough of the population vaccinated. Do temperature and humidity conditions in the summertime, for example, in areas help to reduce its infectivity with the vaccine on board? So I don't think we know yet. But I will say it's possible, but it may be due to many factors, and I don't think we'll know until we get vaccine underway.
Dr. Rekha, in your opinion, why do you feel there's a hesitancy around the vaccine? And what are practical to build confidence for patients and for the larger public in the vaccines that are available to us?
Yeah, I know vaccine is choosing to get a vaccine is something that most of our, in our generations, is something that we've kind of taken for granted through many generations because of the push to control vaccine preventable diseases. So the more recent generations have actually not lived through the kinds of epidemics and pandemics that led to vaccine development. And so that's part of it, is just understanding the role of vaccines and what they can do in protecting the population and how it's necessary to do so. So I think that's a major one. Many people in our generations, in our lifetime, just haven't lived through those. And so there's just like a lack of awareness of how serious, unless you talk to family members or friends who had somebody who suffered from some of these illnesses. The other, I would say, is that there's this development of the vaccine within 10 months, essentially, of last year is historic. And so I think initially there was a genuine concern around, the pace at which it was developed. Do we know it's safe? And just uncertainty until we see other people getting it. Having said that, now there's a few things I will say that I think might help to at least just broader awareness. First of all, these new vaccines that are out, the Pfizer and Moderna, are what we call mRNA vaccines. So they're not made from live virus. They're basically synthetic viruses that basically stimulate protein production in our own cells. So they're not like some of the other viruses like chickenpox or other viruses that are often derived from live viruses, and people worry about getting illness. And so these are safe in terms of the fact that they're not going to give you COVID. That's often a common myth that's associated with influenza that still persists. So and the safety of these viruses has been well demonstrated in these studies, and now that it's had millions of people get these vaccines. That data that is in the studies appears to be bearing out. Very safe. And the third piece I'll say is that in terms of give me 1 second. I had another comment I wanted to make about the safety of the vaccines. So the reason the approvals, at least in the US, the FDA approvals has been under emergency use authorization as opposed to full-scale approval is really to reflect that concern that we want to make sure it's given to lots of people, so to assure that safety bears out when we actually take it out into the general population. So I would imagine not in the not too distant future, we will see the FDA approve the vaccines, these vaccines, and sort of fully approve as opposed to under these emergency conditions. So those are, I think there are genuine and valid reasons that people have for being concerned, and because it's a new vaccine, they worry about the communication and building trust in governments and the public health system. Are all components of what drive, I think, individual beliefs or concerns. I think there's a really important need to communicate and educate the public and really provide as much information and assurance and confidence about the safety, about the efficacy, and how critical it is to protect not only individuals, but also those around them, to start to turn the corner and you call these terms like flatten the curve and control the pandemic. It's going to be essential. And so that messaging and connection with public at all stages is going to be very important. And I think it's just getting started.
Thank you. And touching a little bit more on the technology behind the vaccine, what could be the potential benefits of RNA for future therapy?
Again, because these are producing producing the proteins that make the antibody directly, and because of the safety, and there's like engineered vaccines, and because of their safety profile. And the value in terms of not having to use the traditional vaccine methodology, which is using egg production and letting it grow. And so there's a delayed process in producing the traditional vaccines like influenza. And so this is a remarkable breakthrough in technology in being able to shift and have more reliable production and speed, so that potentially with influenza, with what happens every year, there might be slight changes in the virus. So the production for vaccine has to begin, if your vaccine is rolled out in October, it has to begin in the spring. And so it takes months to generate it. So there will be, with this methodology and technology, I think that'll allow more agility and the ability to respond faster for changes that might occur in the vaccine and the virus over time.
Great, thank you. And we find that this pandemic is being compared to the H1N1 influenza, Spanish flu. How does COVID-19 compare to these past pandemics?
I think that, first of all, I think this is the pandemic of our generation. At this scale of a transmission around the world, I think what sets it apart is the fact that we are now a global community. And with travel and commerce and the globalization, what happens in one pocket of the world now is inevitably going to affect another. And that's true for foodborne illnesses as well as these viral illnesses. So I think the experience with H1N1 and now, of course, this COVID pandemic will set a new, I think, awareness about about communicable diseases and in understanding that we are all interconnected. The other thing that sets it apart, I think, is the advances and the evolution of our scientific breakthroughs, and whether it's from laboratory testing to treatment options to with pharma and new drug development, to doing the clinical trials that actually bring that information and bring confidence. So the speed at which those are able to be accomplished now, I think this has set, certainly has been incredible breakthroughs. And of course, vaccine development, to the speed at which vaccines are developed and the different types of technologies. So no doubt that those are all critical. I would say the one thing that's probably demonstrated as challenges equally is the ability for the public health infrastructure. I think the 1918 pandemic spurred a significant investment in public health, and I think over the many decades, some of that has kind of been reduced. And so I think, as we've experienced over this last 2 decades, between SARS and the Middle Eastern respiratory syndrome and H1N1 pandemics and influenza, Ebola, I think we are recognizing that these infectious diseases and communicable diseases are cyclical, and there's probably going to need to be an important investment in public health and global surveillance and monitoring that will need to continue.
Thank you, Dr. Rekha. I would like to ask you one more question before we go to the live Q&A. We have some great questions coming in. I can see them on my screen. So I'd like to read a little excerpt from Dr. Michael Ben Adret. This pandemic is going to have a lasting effect on our society. People are now cognizant of how viral illness spreads, and COVID-19 is not the only viral illness out there. I expect there will be a heightened awareness of infectious disease risk, hesitancy around large gatherings and tight quarters in places such as airplanes, and more skepticism of people being really close together in general. Would you agree? And what would you say? How will our lives continue to be different?
Well, I would probably have a qualified response to that. I mean, I would generally an optimist, and I think that there's no doubt at the moment there's heightened awareness, but as we see even now, there's a little bit of a disconnect in understanding the relative impact of testing and transmission. So we have a lot of work to do still to connect with the average citizen in understanding what what it means to have to contain spread. And that's just the fact that we have lived in a society that's been relatively protected. We've been very fortunate. And I'll say, though, I mean, some of these measures that we talk about, like hand washing and covering your cough, those are not new, right? Our moms taught us that from the time we were children. And yet it's such a simple message that it's trying to get a consistency in the face of this remarkable virus that, even if you wash your hands and cover your cough, that's not enough. You got to stay 6 feet apart and wear a mask to cut down the risk. So that level of change in our lives, I think will certainly be remembered for a long time. Whether it will fundamentally change behavior across, across the spectrum, I think it remains to be seen. I think we certainly have, likelihood that they will be, this will be incorporated. These factors will be incorporated into guidelines and policies. For example, schools and colleges. There's probably sector in healthcare. So I think we'll see a incorporation of some of the learnings from this pandemic. So it'll strengthen some of the existing policies, and that will be one way. So it's only going to be as effective, I think, as the memories that we have, and also the infrastructure we put in place, both in terms of policies and guidelines, and also a public health investment in public health. I will say that probably we'll see again a resurgence of investment in occupational health programs. And because this will, we're going to have a long tail with this pandemic. And even with the vaccine, there's a lot of questions unanswered. So it generally, from learning from past pandemics, it takes generally 2 to 4 years to really recover. And I suspect there'll be lots of conversation around this about what we might be able to, hardwire, what guardrails, what might be able to put in, and how can we engage the public and individuals in really incorporating some of these best practices. So I mean, I have a lot of faith I mean, not me, I have a lot of faith, but I believe that once we start to see the impact of the vaccine in certain populations, such as nursing homes and others, and we start to see a drop in the transmission and infection rates, that is the kind of data that we need to get in front of the public to show that it works in vulnerable populations, and it can work in larger communities like schools and communities. And so I think that's how we win the hearts and minds and convince people that this is important. I think lastly, I'll say that it will be very challenging not to slide back unless we have some, not only these guardrails, but it will take a tremendous amount of political will and social acceptance that this way of life we just need to live with, probably, and embrace for some time, and some elements of it continue to be incorporated. I mean, handshakes, just think about, lots of 20 years ago, there was a lot of effort around hand hygiene to say, don't shake your hands, do the fist bump. And now, we see that, handshaking is now the elbow bump. So there'll be some ways to market and really highlight some of what we consider culturally important or accepted habits and traditions that might be impacted.
Thank you so much for sharing that outlook. Let's jump into our first question from the audience. This viewer on YouTube is asking, it will be interesting to know Dr. Rekha's views on whether she sees the pandemics becoming more common going forward, and great interview. Thank you for that question, Dr. Rekha.
Well, I think in terms of understanding the term pandemic and frequency, I mean, I would have to say yes, but at the same time, it's a reflection of our evolution of social and economic and globalization. So, we have lots of epidemics and outbreaks yearly with foodborne illnesses that because of cross-border exposures. But I think these viral illnesses, we've seen a cyclical and periodic epidemics of respiratory illness now, at least for the last 20 years. And I do think that almost every 5 years there seems to be some emergence. So I think the answer is yes. What the cause is, and is it just nature, or is it because we're evolving as in terms of our own interrelatedness around the world? I think it's probably a complicated answer. But we do need to be prepared, and I do think there'll no doubt be another epidemic or pandemic that will challenge us. And however, again, the optimist in me will say that we have the tools and we have the science available to us to be able to investigate, intervene, and then put in those measures, whether it's testing, containment. So those tools and strategies essentially can be applied from one to the other based on those factors that may be associated with each one, whether it's communicability, severity of illness, and the kind of mechanism of spread. That's a great question.
Yeah, great question. I agree with you, Dr. Rekha. There's a lot of learning that's happening in a very short amount of time. We have some questions, a few more questions on the vaccine, which we'll jump straight into. You have mentioned that the vaccines have been effective. I wanted to ask whether people who have had coronavirus need the vaccine or not, since the main purpose is to develop antibodies. Essentially, how necessary is the vaccine to those who have already had COVID-19?
Yeah, this is a very common question. And the short answer is yes, that's the recommendation. And the reason for that is that we just don't know how durable the protection is that somebody achieves if they've had COVID, whether they had mild illness, severe illness, it's not clear. We just don't know. And so having one standard has been the current recommendation from all the public health agencies. So when somebody has COVID, we do know that in following those individuals, that rarely do they get a repeat infection, but that's not always the case. There have been some reports of people who've had COVID once who may get reinfected. Typically, though, that protection appears to be maybe up to 90 days, as far as we know. We just don't know beyond that. And so the current recommendations are that when somebody has COVID, if they develop antibodies, we just don't know how long they're effective and they're protective. And that's true for the COVID vaccine as well. But because we're in the height of the pandemic still, I think the recommendation is that everybody should get the vaccine regardless. But those who had COVID recently might be able to wait, out to a couple of months or 90 days. So the CDC's perspective is that once somebody has had COVID, they they may have a positive test by PCR for long periods of time, even though they're not infectious. But beyond 90 days, I think it's recommended definitely everybody get vaccines. So the short answer is yes, even if you had COVID, you should get the vaccine.
Great, thank you. And I think you might have answered part of the second question with the reference to the 90 days, but this question is asking, I want to ask about the myth or fact about antibodies disappearing after a period of time. I heard 3 months or 6 months. Do I have a risk of repeated similar or more severe infection after that period of time? Can someone truly become immune to the virus?
All fantastic questions. And I think I think I mentioned that already, but I can expand on that. The issue of protection after having COVID is not really well understood. So it appears that per the CDC's guidance, out to 90 days is sort of as far as they're recommending at this point. Will you have a more severe infection if you get another infection? Again, there's been so few cases that have been reported in the literature. It seems to be all over the map. Some individuals have had slightly severe illness and others have not. But I think the key point is that it's not clear to us yet. We don't understand when somebody has natural COVID infection and they have, whether they have an antibody response or not. We don't know how protective that is and how long that protection occurs. So they've sort of cut off at 90 days for right now. We want everybody to get the vaccine. However, I will say that even with the vaccine, it appears that it seems to have the protection for out to 6 months so far, based on the studies that have been done. But we have to walk through the rest of 2021 for us to really understand how long will the protection last? Will we need to give another booster for next season? And some of those questions are hard to answer unless we at least get enough people vaccinated and start to study those populations. I hope I answered that. There was maybe another part to that question that I may not have gotten to. I want to be sure I.
I think you.
Second part about semi-annual, right? It's not clear, but I will say one other thing, that it appears that even if you measure antibodies in the blood, even if the antibody level of antibody may not necessarily correlate with how protected you are, because there are immune system works in really interesting ways, and there are some memory that your cells may have, even if your antibody response is not positive. And we've seen that with other illnesses. So the level of antibody is not necessarily the predictive factor. It is, we just need to understand going forward how long this protection can last. So the last question about can somebody truly become immune to the virus? I think those are great questions. And I think right now it's about how can we get enough protection to control the pandemic, and assess how long it lasts, and do we need to reboost people, and so those, some of those questions are absolutely front and center, and we don't have the answers yet.
We're getting a little bit more specific with the vaccine questions. Can you tell us, Dr. Rekha, what is the difference between the vaccines? Can the Pfizer vaccine be given to someone who is 83 years old?
Yes, so the Pfizer and Moderna vaccines are essentially similar methodologies, and the same methodology, and they're safe. The only difference between them is one requires storage at an extremely cold temperatures in very specialized freezers, and the Moderna vaccine doesn't need that level of freezer space. But yes, the answer is yes, they're both very safe, and they can be essentially not much difference between them. And then again, can you give it to somebody who's just had COVID? Yes, and it's not. The answer is yes. It can be given to somebody who's had COVID.
Thank you. Our next question is very interesting. It's worded quite longly, so I will condense it. If somebody is asymptomatic, do they transfer an asymptomatic strain, or is being asymptomatic just a reaction of the body?
Yeah, great question. It is not a different strain. It's just the same virus, but it affects people differently. Just like any infection, if you have a common cold, somebody may have, feel worse than somebody else. And but the asymptomatic only means that you have the virus in your upper respiratory tract, so it can be communicated when you cough or sneeze, and if you don't cover your cough. Or when you talk for long periods of time with somebody, and maybe that's a good way to think about it. Even if you're not coughing or sneezing or having like a cold, that the fact that you're in close with somebody, if you're sneeze for some other reason, or you're talking for long periods of time, or you're singing, any of those can transmit. Even in our regular talking, we expel these droplets without necessarily seeing them, that contain the virus, and they can infect somebody near us.
Great, thank you. Our next question says, Dr. Rekha, earlier in the webinar, you mentioned about blood clotting. What puts somebody at a higher risk of blood clotting, and what pre-existing conditions would that person have?
I think we're learning these individuals who have a more serious disease with COVID appear to be ones who have some of these manifestations. So those, some of those factors are, again, teasing out specifically about clotting versus not is at this point a little difficult, but those with severe disease appear to have, that seems to be part of the manifestation of the illness. And so ICU, people requiring ICU care and hospitalization. And so typically those are individuals who are elderly, have underlying risk factors, and in some cases, those who have a higher body mass index, so obesity, diabetes, a number of underlying health conditions that put people at risk for having more severe disease. And then in those who have more severe disease, this clotting phenomenon seems to be an important one to be aware of.
Great, thank you. We will take about two more questions. So one viewer is asking, is there enough clinical study to indicate the impact of COVID-19 on pregnant women?
Yes, so those are clearly very important. And so just as we learned with influenza over time, that influenza during pregnancy can cause complications and can be a risk factor for more severe outcome. That's why we recommend pregnant women get the flu vaccine. Similarly, early on, we were trying to learn from the New York experience and others whether pregnant women had a higher risk factor, a higher risk for bad outcomes, and some of that data is emerging. And the answer is yes, pregnant women, just like with other viral illnesses, may have more complications. So it's important I think, to, even though the vaccine is not tested in pregnant women, it should be safe, and it's still, though it's not a mandate, it's still recommended. But yes, so pregnant, given what we're living through, I think pregnancy is definitely a concern. Protecting yourself, from your environment is very important.
Great, thank you. We'll take one last question. Dr. Rekha, do you foresee a long-term lasting cultural behavior change as a result of this pandemic?
Well, I would like to say, I'd like to say that I believe there will be some change. It will last for some time. I think there's no doubt in our generation, in our lifetimes, the people who've lived through this pandemic will remember this and how it impacted, all levels, all parts of our society. Think about our children, school-age children, and people in higher education, how their lives have been disrupted, and how our workplaces look now in terms of the distancing and the plexiglass. So I think no doubt that there will be some awareness. How that will translate to shifting to incorporate those behavioral aspects. Hopefully there'll be some continuation of some of the basics, and hopefully we don't have to wear masks forever. It's certainly not something, socially, that we're used to, but it's being aware, getting vaccinated. Hopefully vaccine acceptance will become, again, something that this generation, who've really not lived through other major pandemics that have destroyed lives, and in which could have been prevented by vaccines, and the development of vaccines demonstrating the safety. I think that will be an important thing that I hope remains. And then other behavioral changes is really around the basics of hand hygiene. Those don't change every year during influenza season. Those are the common messages: hand washing, covering your cough, and of course, food safety is equally important in terms of protecting oneself from infectious diseases. So I think there will be a broader awareness of protecting oneself from communicable diseases. But I think we need to do a better job of continuing to have those reminders and build that education awareness into every part of society.
Thank you so much. Would you have a closing message you'd like to share with our viewers today, Dr. Rekha?
Well, thank you so much for allowing me to join this session. I think, as I said, we are living through unprecedented times, and I think what it has illustrated for us is that as a society, as a globe, that we are all interconnected. That in many ways, this will fundamentally change how we think about each other in terms of communicable diseases, and how that what happens in one part of the world is inevitably going to impact another. I also think that I really believe that we will turn the corner. That we have the ability and the tools to control this pandemic, and we have the technology and the science and the will, the infrastructure that we need to get in place to actually start to impact the between vaccines and behavior changes. And I think we'll get there very soon. And it will, I think it'll, as you pointed out, as you asked, I think this will fundamentally, shift our understanding of communicable diseases. I think we have a long road to go. Well, I think by later this year, hopefully we would have control of the pandemic, but there's a follow-up that we'll need to invest in terms of public health, and whether it's contact tracing or testing strategies. And importantly, I think we do need to start to get that conversation around the investment in protecting the public from global communicable diseases as an important component of our future. So I wish everybody well, and be safe, and get the vaccine.
Thank you so much for that message of optimism and wonderful reminder as well. Thank you for being with us this morning, Dr. Rekha. It was such a pleasure. having you on the session today. And I'd like to thank everybody who joined the session, who submitted their questions. We hope you've gained some interesting insight from today's discussion. If you'd like to see more videos like this, please check out and subscribe to our YouTube channel. Have a great day, everyone. Thank you, and see you next Wellness Wednesday webinar. Thank you.
Thank you. Bye.